Thanks everybody for joining in. This is Vet Chat with Heather Wallace from Bridle and Bone and Dr. Kendra Pope. We recently had an appointment with Gonzo, and he was presenting with a limp and showing some signs of pain in his hip area, so I was really concerned. So I brought him into you. Yeah. And so tell me, I knew what you do, but I was really happy to see you gave him an actual evaluation. I would see it any other place. There was no, sage.
Yeah.
Is that so dorky to say?
Yeah.
I knew it, but it was our first session together, so it's one thing seeing it.
Yes, that's true. That's funny.
So tell me, when a dog comes to you with some pain in their hind end or just presenting with any kind of pain, what do you first look for?
Yeah, sure. So, as a Western doctor, you still have all of your Western diagnostics, which one of them is your physical exam. That is something that I think veterinarians are very good at doing, because our patients can't say, hey, doc, it hurts here, and so we have to figure out, well, when we touch them, when we do our physical exam, what is it that is bothering them? And so you do things like extend and flex joints. You push on certain muscle bodies. You, palpate, and you look for tenderness, sensitivities, weaknesses, things like that. You can take it a step further when you have your Eastern medicine approaches, or if you have acupuncture training or chiropractic training. There's certain trigger points and things that you can look for, and that's what I did with Gonzo. I was searching for his trigger points related to his hips and to his stifles, and to see where he reacted. And so that helped with my conventional exam. My non-traditional exam, it helped to put it all together and helped to make the picture clear.
And how did doing the trigger points help you with the physical exam? Because it didn't look like he really presented with anything on the physical, with the stretching and the flexing. But what did he do differently when you hit the trigger points?
Yeah, well, you had warned me. You said, look, he's not going to cry out. He's not going to try and bite you, but his tail's going to stop wagging and he's going to look back at you. And that's, his ears went down, his tail stopped moving, he looked back wondering what I was doing, and it was repeatable. Sometimes, patients, when they're in the office, they'll get nervous, or if you do get to an uncomfortable area, they'll do something like that. And if it's not repeatable, sometimes you wonder. And all of these things that are helpful, but really, like with any diagnosis, the confirmation that you got it right comes when you initiate treatment and you have the response that you were expecting. So we talked about in the room, okay, we think that it may be a back problem or a hip problem, but if we start treating him conventionally, acupuncture, whatever we decide, and he doesn't respond the way we want him to, then that's time for us, or he gets worse, to get an x-ray, see an orthopedist, anything like that.
Or even what you said with the stem cells, which I had no idea was an option for my pet.
Yeah.
I'm happy to say that he did great with the acupuncture.
Yeah, awesome.
He was like a porcupine. With all the needles he needed.
Yeah.
But he went into, what was it called, like
Accustone.
He came home and went right to bed.
Yeah.
And then I gave him the turmeric and boswellia and the glucosamine and green lip mussel and all that, and so he's been doing fantastic.
Great.
So that makes me feel a little bit better knowing that he's doing so well. And so,
because we're not foregoing the conventional part.
Right.
We're just trying to use another tool too, to see where it gets us. And if for any reason things would get worse, he wouldn't respond the way we wanted him to, we would need to use more than 3 treatments or so, then we would say, hey, Heather, I think something might be going on here. It's time for us to investigate further.
Yeah.
But yeah, back to your point about the stem cells, really cool and interesting things are coming out now. They've been using them a long time, but they're not FDA approved in people, and so they're still, doing clinical trials, investigating their benefits. They're fairly well known for arthritis, orthopedic pain, things like that, but they've recently become less invasive. They used to require a surgical procedure that took some fat out to extract the stem cells, and now it's just a blood draw, so they're becoming much more easy to administer and less expensive. And then also the conditions that can be used are really becoming limitless.
Really interesting, right? And just for clarification, this is not Gonzo. Bo came with us to the office today.
Yeah!
just for a visit because he loves the vet. So, you know,
do.
your dog does not have to be scared
Exactly.
of the veterinarian's office. I don't
Say
know.
it's nap time here, right?
I know. I don't even know if you could see him. He's laying down on our laps. So.
He's a good boy.
Yeah, he is.
Or,
So what would you recommend for anybody who had an animal that presented with a limp out of nowhere?
Mm-hmm. Yeah. So, you know, I serve as I'm another, and I've said this before, a teammate on the team. You know, there's lots of different doctors. So most of the time before you come to me, you probably will have gone to your primary care veterinarian, your specialist, whatever. They may have done an evaluation. And Gonzo's had this problem before, and so he's been evaluated before by his, you know, conventional veterinarian. And so we have an idea of what's going on with him. We know he has hip joint problems, and make sure there's nothing serious. You know, we don't think that it's something like a fracture or something scarier, you know, or more sinister.
Yeah.
And then once we're sure, or at least fairly certain that it's arthritis or underlying joint disease, that's where we can then say, okay, let's try some acupuncture, let's try some herbal remedies, let's talk about experimental things like stem cell therapy or other options that are out there, massage, chiropractic, whatever it is that we can use, because a lot of times just those small adjustments help them to get on track so that we can, you know, move forward and support their bodies.
You know, and so I think, you know, as owners, we are so familiar with our pets that if they're doing anything out of the ordinary, we have to get them checked out.
Yeah, absolutely. Especially if you, you know, you are in a position where you have more knowledge than maybe a typical pet owner because you have anatomical training.
Right.
You know, your hands are your tools that you use to feel for different things. So you obviously are picking up on something that maybe a typical owner. But I've had owners come in and say, I was massaging him like I normally do, not your massage, but their massage.
Petting, yeah.
Yeah, and they seemed uncomfortable, or they're not standing the right way, or owners, that's how owners will find masses too.
Yes,
I was petting
so
my dog
important.
and I found a lump, you know?
Yes.
So even though they may
Right.
not be doing the type of therapeutic body work that you're doing, when they're, you know, bonding with them or petting them, they can pick up on things too. So it's all important.
I think it's great. And, you know, it's funny, though, because my husband goes, oh, it's his paw.
Sorry, honey.
You know, like, you know, you forget, like, I do this. You know, I'm pretty sure it's not his paw.
Yeah, yeah.
But it was cute. So I think, you know, as owners are the first line of defense for their pets. I mean, they have to be aware. And, of course, you don't want to be a hypochondriac about it. But if you notice something different and it's not going away or it's getting worse, then it's time to call your vet.
Yeah.
You know? And so I'm just hoping Gonzo continues to improve.
Yeah, absolutely.
Because obviously that's a big fear of mine.
Yeah.
My first dog was a German Shepherd, and she had hip dysplasia and passed away because she really, it became very bad.
It can, yes.
But you know, I'm hopeful that even if it does become something like that, is he eating paper? Is that your paper?
You told me he was going to eat that.
Told you.
Mom told me you'd eat it.
Bo, yeah, who eats anything? So I'm confident knowing that even if Gonzo, as he ages, does get a little bit worse, that we've got all the tools in the toolbox to be able to help him and hopefully get to the point where, you know, he has still a great quality of life. I mean,
absolutely.
You know, 4 days after acupuncture, he's having a puppy play date in the backyard.
Yes.
Jumping off all 5 steps, sorry.
Yeah.
He tried to keep him in.
Yeah.
Just not
I
happening.
tried to. He said, I felt fine, Mom.
Yeah.
Yeah.
So, okay. So this has been Heather Wallace and Dr. Kendra Pope for Vet Chat. And I hope you guys tune in again. And again, visit us online. And you can visit Dr. Kendra Pope's website coming up online soon as well. But instead, check her out on Facebook at Dr. Kendra Pope.
Take care, guys.
Bye. Bye.